Gunjur Online News. Good evening and welcome. What's your name?
Thank you very much. I'm a member of Gunjur for Health and also a staff at Gunjur Health.
Okay, thank you so much, Mamadi, for that wonderful introduction. And also another young man here with us who will also introduce himself along the program.
Yeah, I am Mahmoud Bojang, member of Gunjur for Health. I welcome you all to the program. Thank you.
Okay, those are the two young men. Today we'll be discussing on the sensitization program on the COVID-19. As we all know, the world is in a very crisis time. It's a global pandemic, whereas everybody is, being disturbed or being, in a very bad situation of this corona virus, because it's a deadly virus. Much more the front liners, the forefront fighters who are, the health personnels. So today, this evening, on our webpage, Gunjur Online, we'll be discussing on the sensitization coronavirus. So we will start with Mamadi on the topic of sensitization campaign, Mamadi, because rules for people to follow up in order for. So we will be discussing today this evening on the sensitization campaign. Mr. Mamadi, when we talk about, sensitization of COVID-19, how can we express or how can we discuss, more on this, or how can we throw more light on this sensitization? What do we need to sensitize our community about of this deadly virus? You welcome to the show, Mamadi.
Okay, thank you very much, Mr. Jane. I think as healthcare workers, we have a lot to do, not only taking care of the patients at the facility level or of the treatment center or anywhere else that they can have our service, but also sensitizing the masses on the importance of the safety precaution that we can use to prevent ourselves from this coronavirus is something that we need to always keep on sensitizing people so that they can be aware of it. And also the denial, it is something that it is really disturbing us at the moment, because most of the people, when I say denial,
why if you talk about denial along the discussion, what do you mean? Or you have like there are still people who are not believe that this is something real. What do you mean by denial?
Yeah, that's what I can say, because like if people are really conscious about this
Virus.
virus, I think by this time we will be able to contain the virus. But
Okay.
the problem with us, the Gambian, is that we want to believe it when it affected our immediate family or our immediate friends. So this is the problem. I think we are at a stage where these denial issues should be a thing of the past.
Okay.
Because at the moment there is no one who can say I haven't heard about this
But
deadly virus.
but if I may come across intervene as of now, I don't think many people will stand at that at start stand at that stage to say this is not something real, because even in the Gambia as of now today, you only heard of cases that is like 100 plus. So I think it's something that people are now considering it as something real.
Yeah, I can say some of the people do believe that it is existing, but still we have a section of people that who doesn't believe that this virus is existing. The reason why I said so, like for example, if we all believe that the virus is existing, I don't think there will be necessary even for police or any other security service to test us for just only putting on masks to prevent yourself or prevent the person closer to you.
Okay.
So people are not doing it. If at all they are doing, if at all they believe that this virus is existing, we would have problem on that.
Okay, Mr. Bojang, it seems like, if I may get Mamadi very well, the regulations on the face mask wearing, is something that people are not adhering to that regulations. So I think that also is a challenge, because if you're sensitizing people, if you're sensitizing massive on, the issue, or the use of face masks, these are all, regulations, or these are all, practice that, we are doing it in combat of, COVID-19.
Yeah.
So I think, that's something very key, because even if you just go outside, you meet with, hundreds of people, who are not putting, face masks, who are not wearing face masks. If you ask them, I left it at home, I'm having it, it is here in my bag, it is here with me in my pocket. So I don't think, such, behavior or such act, will help us in combat of COVID-19, Bojang.
Yeah, I think what we need to do as citizens of this country, or can say like, what we need to do is to change our behavior.
Okay.
That's the most important thing. Because I think people have been since the beginning of this COVID-19. We have had news from different news outlets, from different platforms, even on radio, television. We have had, sensitization on this COVID-19 and how people can go about to prevent themselves from this COVID-19. So I think the most important that we should try and do is to change our behavior. That's the only thing that we need to do. Because like, you will talk to an individual, try and do this, try and do that to prevent yourself from having this coronavirus, but yet they try to do those regulations or to follow those precaution methods. So I think most important thing is, let us try and then change our behavior.
Okay.
Even wearing of this mask, someone say, for me, I'm not being brief when I wear this face mask. Someone say, what is the essence of people wearing? What's the essence of wearing this face mask? Some even tell of criticalize this coronavirus issues.
Coming to intervene into that, if somebody is trying to, know the use of face masks, I think, for those of you people who are health personnel, and then for that of us who are at the radio, doing, this sensitization campaign, yeah, you can, simply explain, yes, of course, the use of face masks, will prevent you, from, getting virus, and also others, for not getting virus, because simply, if you talk to me like this, I am not, using face mask, or you're not using face masks, and you said, what is the use of this? I will simply explain, okay, yes, the use of face masks is to prevent you and then prevent myself from, contaminating the virus. But sometimes I think, the way of, addressing sometimes issues, will also, contribute, Okay,
let me comment.
Okay.
Yes.
Mama, do you want to try just something?
Yes, because I experience a lot when it comes
of course,
to
you
this,
must, because you are the frontline fighters of the virus.
The problem is, people think that this wearing a mask is just something that they are doing it for people, or they are doing it for the government, or the government want the government want to disturb us for
wearing masks.
Because the reason why I said so, you will see someone with a mask, and the person will be traveling, but when he is coming to enter the vehicle, the apprentice will stand and say, if you don't have mask, you will not enter here, and the person will just take out the mask, put it, enter the vehicle. Where if the person settle down, he or she will remove the mask, put it in his bag, or put it under the chin and be there confidently like nothing happened. So like that will continue until when they are about to reach the police station, and the driver or the apprentice will shout again, the police station and everyone will start putting on masks.
Okay.
Can you tell me what did they think? They think that they are doing it for the police.
Of course, that is simply telling that's simply telling us, or that is simplifying that they are just doing it in order to escape the punishments if you are caught of not wearing mask. But the danger is the danger part of it. That is like you can be contaminated with the virus simply by not wearing the mask.
Yeah, what
you can touch in somewhere, whereas the virus is already been there, and then once you touch those places, those surfaces, you can contaminate the virus, and then get into touch of your faces, your mouth, your nose, because there is no mask. But when there is a mask, it will prevent you, even if
human people is that these masks that we are wearing, most of the masks that we are using, the wearer from having the virus, it prevents those who are closer to you or those who are those you are with. It prevents those people from getting the virus from you. But most of the time, it doesn't prevent you from having the virus from getting the virus from them. So, like, I am putting on a face mask. Mahmoud is putting on a face mask. You are not putting on a face mask. Okay. We are trying to prevent you, and you are not trying to prevent us. What should we do? We should not even wait for the police. It is our right to ask you to put on masks because we are preventing you, and you are not preventing us. So people should understand that.
Okay, simply, if I want to intervene into that, Mr. Boyan, it's like, I mean, I am not putting on the face mask. I'm going to take an example of myself. I'm not putting on the face mask, and others around me are putting on the face mask. And then we are like, I mean, even though we have these social distances, but it's still like, I mean, I am not, I mean, protecting those people as they are protecting, me, Mr. Boyan.
Yes, as Mawali Badal explained, that's the issue. So we should try to wear masks wherever we are. Because if I wear, you don't wear, I mean, like, I'm going to protect you, but I'm protecting me. Because the masks we have here, they cannot hold onto this virus. They can only prevent, like, if you still have something, meaning like it may contain some virus. So it will hold on to the mask that you wear. You understand? But now if you speak, so it's or in, only the one can do that one. But for this one that we normally buy from the shop, and then this one, the surgical mask, those one cannot prevent all